Hello, I'm Dr. Patrice Harris, Director of Fulton County Health Services. Fulton County's Health Services team serve one of the largest counties in the state of Georgia and in the southeastern United States. Healthline is a program that highlights some of the department's services and shares some important health news that impacts the community. On this episode, we'll discuss the dangers of prescription drug abuse with the Medical Association of Georgia, or MAG, Foundation. Healthline begins right now. Welcome, everyone. We begin this edition of Healthline by discussing prescription drug abuse, misuse, and overdosing on prescription drugs. This is a public health crisis. Joining me now to talk about this is Executive Director and CEO of the Medical Association of Georgia, or MAG, Donald Palmisano, and Dallas Gay, Think About It Community Co-Chair. Welcome to Healthline.
Thank you so much for this opportunity. We really do appreciate it.
Well, first let's talk about the MAG Foundation and its programs.
Absolutely. The Medical Association of Georgia, we're a volunteer physician organization with over 7,500 members. The Medical Association of Georgia Foundation is our philanthropic arm of the association, and we do a number of programs from Georgia Physician Leadership Academy to helping out distressed physicians and helping students with student loans. Our marquee program is the Think About It program, which addresses prescription drug abuse. And I'll tell you, I'm honored to be sitting here with Dallas Gay, who brought us the program a couple years ago and is very passionate about the program.
Well, we welcome you as well. People may not realize how common prescription drug abuse is. Can you share some statistics you have or some information that the community may need to know?
Yes, I'll be glad to do that. Prescription drugs abuse is one of the leading causes of drug abuse and addiction in the United States. Over 41,000 people die from all drug overdose, about 24,000 of those from prescription drugs. And the most catastrophic of those are the various opiate painkillers that we take so often. And we find that most of these drugs that are diverted to some form of abuse are coming from family and friends or from our medicine cabinets.
I think this is an issue that really hits close to home and deeply affected your family. Would you share a little bit about that?
Yes. In about 2009, we became aware that our grandson, who was in high school, was taking prescription drugs for non-medical purposes. He had had his first painkillers when he had his wisdom teeth out, and he instantly liked the effect. So over a period of time there while in high school, he continued to engage in risky behavior of finding those drugs, some from my medicine cabinet and others. But what we didn't realize is that you cross a line from risky behavior to addiction. And once it goes to addiction, it's extremely difficult to deal with. So he's continued on that into college, and after his freshman year, checked himself into a major drug recovery facility here in Atlanta. And after 2 years of recovery, went out one night with a friend, had alcohol and opiates again, and didn't survive that event. That was quite an eye-opener for us.
Well, thank you very much. I know that is a difficult story to share, and we really appreciate you sharing that story. And I think that it shows that no one is immune to this issue. And again, thank you for sharing that story. And I think that one reason you share that story is because that spurred you on to action, to do something about this problem.
Well, I served on a major hospital board at that time and thought we were doing a lot of good in the medical community. And then I realized that we were part of the problem, that we were the suppliers of these drugs with physicians prescribing them, careless people like myself not taking care of their drugs. So we came up with a program called 4 Steps to avoid prescription drug abuse. And that's the program we've been working on for over 2 years.
Well, let's go over the 4 steps of preventing drug abuse. Can you or Donald tell our listeners about those 4 steps? I think the first one is starting with taking your medications as prescribed.
Well, that's true. A lot of people get the pills, so they want to take all they can because they like the effect of them. But we suggest you only take the minimum amount you need for your conditions, particularly those at-risk drugs like painkillers and anxiety drugs. That leads us then to where the drugs come from that are diverted to abuse. Over 70% from family and friends, so don't share your medicines. If I give my medicines to you, I don't know what else you're taking, and there may be a conflict there. Mm-hmm. Plus, it puts me in the position of being a prescriber, which I'm not doing. So don't share and don't take anyone else's medicines. Then the third step is to safeguard those medicines so you're not part of the supply chain. When you carelessly leave those around your home, as I did, then you become a drug dealer, an inadvertent drug dealer. So we suggest that while you're taking those drugs, that you secure them in a locked place that's not accessible by anyone else. And then the last step, the 4th step, is that if and when your medical condition is resolved or over, you dispose of those drugs that you no longer need. And there's some ways to do that that's safe. First, don't flush them down the toilet because they stay in our water supply. Second, if there is a law enforcement facility anywhere near you, almost all of them now in Georgia have a drug drop box. You walk in the door, this looks like a big mailbox, but it says for disposal of drugs. Put them in there. They then go into drug custody, evidence custody, and then to incineration, the safest way to get rid of them. If you just can't do that, can't bring yourself to go to the law enforcement, then we recommend you take those pills out of the bottle and crush them up and mix them with your garbage and throw the bottles away separately from the pills. Those 4 things could help to eliminate a huge amount of drugs that are diverted to use.
Well, thank you very much for that, and I'm sure that our water department would appreciate your point about not flushing them, because I think a lot of folks get the information that you should flush your unused meds, and so that's very important because we certainly don't want them to get into our water supply. So,
if I might make one other comment on getting them out of the home, you don't know who's going to get them. It might be your children, your children's friends, but it might be your friends because addiction does not know any age limit. It could be anyone who's taking those drugs. And to say that my children would never do that is a little bit naive today.
I think that's a good point. Donald, do you have anything to add about any of those 4 steps?
I do. The 4 steps is part of a public awareness campaign to really get the education to the public, but also to physicians and pharmacists and also other providers in the community. And that's really the first step in tackling this problem, is to get the education out there. Because once people start to understand the dangers that are associated with it and then have a roadmap on how to try to solve the problem, it's going to be better for everybody. And ultimately, it's going to be much better for patients.
I think both of you make a good point, because some people say, well, my doctor's given it to me, so there's probably no risk. Mm-hmm. And I think we all know that there are risks with everything. I mean, there are risks with aspirin. So we really do, yes, your doctor is giving you the medications for a reason, prescribing appropriately for a reason, for pain, but not for your mother's pain, your son's pain, your child's pain. So I think that's very important information. Let's talk about more, because we use the term prescription opioids, and people are saying, what the heck is a prescription opioid? So either of you want to take a stab at letting the public know what medications we are talking about when we're talking about opioids. But I think we know there are other medications, too, that are the subject of abuse and misuse.
You want to go ahead with it?
Yes, sir. The primary one that's the most catastrophic is the opioids. Opioids are derived from a poppy plant, same place heroin comes from, but the legal ones are generally under the name of Lortab or OxyContin or Vidacon. And we have published our 4 steps information, and on the back of it lists then those at-risk drugs. The other category that becomes at risk for abuse are the ones dealing with anxieties, like Xanax. And then when you combine those two together, you have a cocktail that's particularly deadly. So any of the pain-relieving drugs that are of a narcotic nature, or the illegal versions such as heroin and cocaine, all come under the caption of opioids.
And you also mentioned heroin. So we all know that heroin is not prescribed by physicians or other prescribers, and heroin is not a legal drug. But talk about this relationship between folks maybe who start misusing and abusing pain medications, and then perhaps sometimes turn to heroin.
Well, what you find is the easiest way to start is go to your medicine cabinet or your dad's or your grandmother's or friend's medicine cabinet and get those prescription drugs, or you've been prescribed those because you broke an arm or something. After that, you like those drugs, and they become harder and harder to get. They become very expensive to buy on the street because people steal them and sell them. They become very expensive, so you look for a lower cost and, unfortunately, a more readily available source of an opiate drug to quiet that addiction that you have. And it requires feeding on a regular basis. So what we're seeing today, after 11 or 12 straight years of increased death from prescription opiates, going up every year, higher and higher, that has now leveled a little bit. But what's taken the place is heroin. So heroin, after being pretty subdued for several years, has now turned up and increasing at a very rapid rate. Cheaper and easier to get.
We'll hold that thought and we'll talk a little bit more about that. But we'll stay right here and we will continue this conversation after the break. Welcome back to Healthline. I'm Dr. Patrice Harris, Director of Fulton County Health Services. Today we're talking about prescription drug misuse and abuse. We're talking to Executive Director and CEO of the Medical Association of Georgia, or MAG, Donald Palmisano, and Dallas Gay, who is Community Co-Chair of the Think About It campaign. So let's talk about Project DAN, or Deaths Avoided by Naloxone. Who wants to take this? And then I'm sure there'll be lots of conversation about this issue.
Well, I'll start it off. In 2014, the General Assembly passed and Governor Deal signed the 911 amnesty law, which was the genesis of Project DAN for us. And under the amnesty law, it encourages someone that is with another person that is happening to undergo an overdose to call 911 and to save that person's life. And if they do that, then that person will not be prosecuted by the law. And also, what it does is allows a physician to write a prescription for basically naloxone, which is a reversing agent for someone undergoing basically an overdose.
Well, that law has given us tools that we didn't have a year ago. And what it does, most of our campaign to date has been on avoiding prescription drug abuse. Now we're shifting to the other end of the spectrum and looking to save a life that's at the point of death. So there's some things that we've observed that are happening over and over again in this country of people who are dying from overdose. There's usually someone with them. There's usually the police who arrive first, and then the EMTs come, and maybe it's too late at that point. That was certainly the case in the death of my grandson. The person with him would not call 911 but fear of arrest, did not know anything about first aid for overdose and how to take care of the person until help arrived. And there was not any of the agent that he spoke of, naloxone, available until the EMTs got there. So we've designed a campaign called DAN, Deaths Avoided with Naloxone. And what it does is to try to make people aware of the new 911 amnesty law. The law is absolutely no good unless people know about it and don't fear the arrest of because they've been doing drugs with someone. The second part of it is to try to educate public, and particularly in the schools, about what is overdose, what are the consequences of it, and what is basic first aid. When we look at opiate overdose in particular, which takes most of the lives, it interrupts the process of breathing in the brain. The brain starts to shut down, telling the body to breathe. So breathing gets more shallow, ultimately ceases. Often what happens during that same period of time is stomach muscles relax. A person's normally laying down, let them sleep it off is generally the thought process. And those stomach muscles relax, contents come up, and they're re-ingested into the lungs, which further reduces the supply of oxygen. So a person dies from that, starving for oxygen. So the third part then, well, first, the first aid is to keep that airway clear, to put the person in a recovery position, perhaps give them rescue breathing to force air in those lungs to buy time to help arrive. Then the third part of it is naloxone, which has the trade name Narcan. It's been around for a long time, but now with the amnesty laws, a doctor can prescribe it to anyone and without fear of litigation arising from it. So anyone who is at risk of an overdose of opiate, who knows someone might be at risk, someone in their family or at work or their friends, any first responders can carry that drug now, and it has the ability, when administered, to reduce that opiate overdose in literally minutes, 1 to 3 minutes, and a person can start back breathing. So what we're going to do, we have been named the beneficiary of a major golf tournament conducted by the Medical Center Foundation in Gainesville, Georgia. And we're going to use that money to buy naloxone for law enforcement throughout Northeast Georgia. At the same time, training them to use it and training the public on first aid and how they can get naloxone to stop an overdose.
So that sounds like that was a very positive step in the legislative arena. And Donald, I'm going to ask you a bit more about other potential avenues that we could request legislation. But I do want, and either of you can comment on this, or maybe this is just my opportunity to comment, that clearly this is a complicated issue.
Right.
And there is no one solution.
Right.
What I understand is that really we need to look at this from multiple venues. So we need to make sure we have Good Samaritan laws in place so that folks can call without fear of litigation or arrest. We also need to make sure that Narcan, naloxone, is available. But Donald, before I get to you on some other legislative remedies, what about treatment? I'm a psychiatrist, in addition to being the public health officer for Fulton County, and I know that treatment is often not available for those who are addicted. And I know it's not your area of expertise, but could you comment on the importance of access to treatment, either of you?
I'd be glad to. Treatment can be very, very expensive and typically not available to many, many people. Even with expensive treatment, recovery treatment, that's not the end of it. It's a commitment to stay sober over a long period of time. Mm-hmm. And one of the things that probably helps that more than anything is being involved in an organization like AA, ongoing, where you with other people that provide that support structure around you.
Yes.
But I would certainly, where anyone can afford it, recommend that 30-60. My grandson stayed at a major institution here in Atlanta for almost 6 months and still relapsed 2 years later.
Yes.
So it's not an automatic cure. There's a whole program that goes with treatment, which is family support, friend support, and something, again, like AA.
You're right about that, and so we also worry about those who don't have insurance and don't have access. And I do know that I believe in the President's budget this year, there are increased resources for treatment for those who may be uninsured or underinsured. But back to some other legislative remedies. What else is happening either in Georgia or in some states around us or throughout the country?
Well, back in 2011, Georgia passed the Prescription Drug Monitoring Program. Basically, that's a database that physicians and pharmacists can check to see what medications a patient has been prescribed. And the pharmacist has 7 to 10 days to put that information into the database. One of the issues with that is that it has to be the physician or the pharmacist checking the database, which, as you know, as a physician, does disrupt the seeing other patients throughout the day. So you do have physicians checking the database, but we're looking for ways to ease some of that administrative burden on the physicians, but still allow them to get that information so that they can see if patients are going to other physicians or maybe going to the emergency room to get other prescription drugs that they're not aware of.
And we just have a few moments left, so let's highlight some of the partners, because I know that there are many partners who are involved in this. So let's quickly highlight the partners that are involved in the Think About It campaign.
We've been very fortunate that we've had a very good relationship with the Attorney General Sam Olens, has been very active, as well as Kaiser Permanente, as well as the Georgia Pharmacy Association, as well as CVS, Walgreens, Walmart, Northeast Georgia Medical Center. All of these, what you're seeing is physicians and providers all coming together, and people outside of medicine trying to address this issue. And that's been the great benefit of the Think About It campaign, is to sit down and hear the different perspectives on how do we address this ever-growing epidemic.
Would you like to say anything else about the partners?
Well, there's still a host of people out there that could be partners, and we're still looking for those. Our Think About It, our 4 Steps material, we have put in to a number of medical facilities. So any physician who's willing to put this in their waiting room, or any hospital who's willing to put that in their offices. And then our prescription bag handout, we're putting these in the local pharmacies as well as the major chains that Donald has mentioned. So a lot of potential for other partners.
And I can't let this moment go, but letting you know that we have those in some of our clinics here in Fulton County, and some of our public health clinics. And also several of our commissioners, the Fulton County commissioners, are very interested in this issue. And finally, some of our law enforcement teams participate in the National Take Back Days. So know that you have a partner here in Fulton County.
And we're willing to work with Fulton County in trying to get naloxone to the law enforcement and to first responders, so that when they do come upon that person that is overdosed, and we can save a life.
Well, thank you. Well, certainly we have much more work to do, but we're very glad that you all have started the work. So how can people get in touch with MAG for more information? You
can go to our website at www.mag.org. or you can go to www.rxdrugabuse.org. And also our phone number for anybody that wants some of this information is 678-303-9282.
Well, thank you. And thank you again for joining me on Healthline. Coming up after the break, we have some quick exercise tips to help you get started on a fitness routine. Stay with us. Exercising and increasing your physical activity is a great way to improve the health of the county, but sometimes it's hard to know where to start. Our fitness expert has some tips to get you on the path to healthy living.
Hi, I'm Robin Parson, the Fulton County Employees Fitness Center fitness specialist. I'm here today again to share with you ways that you can get fit in this new year. Now, last time I was here, we talked about those who were not familiar with gyms, and it was their first time. I kind of introduced you how to use a bike, different stretches you can do, and upper body stuff. But today what I'm going to do, I'm going to focus on exercise you can do at home. A lot of times people don't feel comfortable being in a gym, and a lot of times you have home gyms. So I'm going to show you how you can do exercises in your home gym or just outside in a park. Okay, remember, the first thing you want to do is warm your body up. Remember, we talked about that last time. So what I'm going to do, I'm going to get on the bench and give you some real quick warm-ups to get your body ready. Now, The most important area I feel is, which really should be warmed up, is your upper body, your back, your abdominals. A lot of times your back and your abdominals are weak, so you want to make sure you warm them up and get them ready for whatever exercise you decide to do. So we're going to start with just a simple stretch. So what I want you to do, I want you to place your hands here, and you can tell if you're not sitting up straight, because if you're not sitting on those two sitting bones and you kind of feel a arch in your abdominal, then you know you're not sitting up straight. So what I want to do, especially if you have a bad back or even if you have back injuries, take your hand and press yourself up. And you're just going to roll your shoulders back and just take a deep breath. This is a simple stretch right here. And if you're doing it correctly, you're going to feel it all the way from your upper body through your lower spine, all the way through your legs, all the way down through your ankles. Because I know I feel it. So let's take a deep breath. Inhale and out. Remember the breathing. Breathing is very important. So remember, inhale in and out. Deep breaths in and out. And what the breathing does is really just helps you provide oxygen to your muscles and just get the body going, okay? Okay, so let's take a deep stretch forward. Keep the hands there, because remember, if you have a back injury, or again, if it's your first time, you're trying to get into a warm-up, you just want to protect yourself. It's just a deep bend forward. And press your hands deep into the floor, because if you're pressing your hands deep into the floor and pressing those arms up, you're going to feel that stretch, especially in your lower back, all the way through the back of your legs to your ankles. Good. And come up. And see how simple that was? Now, anybody can do that. A child, a senior citizen, someone who has, again, I'm talking about injuries, you can easily do that. So let's try that again. A simple warm-up. Deep breath. Come forward. And just hold it 10 seconds. Good. Come up. Remember, breathe. We're going to try that again. I like to do at least 3 sets, okay? Inhale up. Press forward. Good. Excellent. Now, those are for my beginners. Now, for those who are pretty much in a fitness level where you can be a little bit more flexible, let's take your arms up. Inhale out. One more time. And all you're going to do is come forward. Same thing, but come forward and touch your toes. Good. Come up. Let's do that again. Inhale up. Exhale out. Inhale up. Come forward and stretch. Good. Deep breath. Excellent. And come up. Last time. Inhale up. Exhale out. One more time. Inhale up. Exhale out. Come forward and stretch. Deep breath and hold it. And for your advanced people, you know where you can go. Touch your knees if you can. But I'm not going to do that today. Good. And up. And that's pretty much it for a really quick, easy warm-up and gets the whole body ready for any physical activity.
Thank you, Robin. Well, I hope you have enjoyed this edition of Healthline. I'm Dr. Patrice Harris. Remember, you can learn all about the services of the Health and Wellness Department and the Behavioral Health Department by phone or online. Click on the department and agencies and then the Health and Wellness link or the Behavioral Health link. We'll see you next time.